Now it's my pleasure to introduce Dr. Sood, a professor and vice dean for research and faculty affairs at the USC Price School of Public Policy, and he's a founding member of the USC Schaefer Center, and he's going to be able to speak a bit more on the serology study. Thank you, Dr. Sood.
Thank you, Dr. Ferrer and Supervisor Barker, for having me here. Before I talk about the study, I want to acknowledge all the people and the organizations that contributed to the study. So this is a true public-private partnership between USC, LA County Public Health, and the LA City Mayor's Office. This study would not be possible without the leadership and vision of Dr. Ferrer and Dr. Paul Simon, who is the Chief Science Officer for LA County Public Health. I also want to acknowledge President Carol Fold, who provided funding for the study, as well as the Jadel Foundation, the USC Schwarzenegger Institute, USC Lusk Center, and many individual donors who contributed to this public health study. We had a lot of volunteers for the study, especially Keck medical students, and I want to thank them for their time that they devoted to the study. So now, what did we find? There were two important findings. The first finding was that, as Dr. Ferrer mentioned, when we tested about 863 individuals who were representative of LA County, about 4.1% of them tested positive. And now we know the population of Los Angeles is of adults in Los Angeles County is about 8 million. So if you take that population of 8 million and apply the 4.1%, what we get is about 320,000 adults in Los Angeles County who have had a COVID infection before April 9th, before we started doing the testing. You compare this to the confirmed cases of COVID-19 in Los Angeles County, what we get is that the number of true infections based on the study is 40 times larger than the number of confirmed cases. So this highlights the importance of using serology testing to continue to monitor this disease. Serology testing can provide important information on the true extent of the infection in our communities. The implications of these findings are twofold. One, it says that mortality rates estimated based on confirmed cases are going to be much higher than mortality rates estimated based on the number of infections or the estimated number of infections. So we could say maybe the good news is that the fatality rate is lower than what we thought it would be. But the fatality rate is not the only number we should focus on. That is not the only number that determines the burden of disease. What the findings show is that only 4% of our population has been infected, which means we are very early in the epidemic, and many more people in LA County could potentially be infected. And as those number of infections rise, so will the number of deaths, the number of hospitalizations, and the number of ICU admissions. So the study says we need to continue monitoring this epidemic through serology testing and other means. We need to take the data we are getting and update and recalibrate our models of what would happen in the future as more people get infected, and then ultimately use these better models, the more accurate data, to guide public policy decisions about how to combat this epidemic. Thank you. Grace, we are ready for questions.